In a joint effort to address the critical shortage of healthcare workers in Nigeria, stakeholders from the Global Health Workforce Program and Wellbeing Foundation Africa have advocated for increased training and retention strategies for healthcare professionals. This call was made during a GHWP sharing and learning event held in Abuja in collaboration with the Federal Ministry of Health and Social Welfare.
During the time of COVID, we all saw how healthcare workers were vulnerable, either by being infected, being exhausted, burnt out, mental health issues, and people started leaving at that time because there was no support for them. Our project provides this support for the healthcare worker to help them to access protective equipment, to help them to gain knowledge as to what they can do for themselves to make themselves healthy. We want to start this with Oyo State, and we are hoping that we can actually scale it up to national. I've said in my report that we need the support from the Federal Ministry of Health for them to recognize that there is a problem in not supporting healthcare workers' health and safety and well-being.
There are people who are working in crisis areas. In some organizations, there is what they call rest and recuperation, R&R. After you work for like 6 weeks in those very dangerous places, you take some time to rest because it can be really exhausting. Those are things we need to start considering.
Toyin Saraki, president of the Wellbeing Foundation Africa, emphasized the urgency of building healthcare capacity to reduce Nigeria's maternal and neonatal mortality rates, which remain among the highest globally. She stressed the need for training healthcare workers to deliver quality, life-saving care.
So we're delighted, having brought what we call emergency obstetric and newborn care training into Nigeria in 2015. At that point, the whole state-level program in Kwara for 4 years, it showed very rapid impact in reducing birth injuries, reducing mortality, and ensuring that mothers have safe births and their children are born safely to thrive. This particular grant from the UK government allowed us to deepen this work at a more advanced level, and we hope the government will continue to partner with such initiatives to really scale up the sort of innovative improvements in quality and care given that actually ensures a safer birth for every Nigerian woman through her healthcare providers and healthcare givers really being experts in the skills that are needed.
The in-country coordinator of GHWP, Estelle Mbadiwe, underscored the program's achievement in training over 3,000 healthcare workers, with 62% being female. She explained that the training of trainers model adopted by GHWP ensures long-term knowledge transfer, supporting universal health coverage.
We started with a scoping activity where we engaged with multiple stakeholders working in health workforce in Nigeria, and we identified national priorities that is important for moving the health workforce forward towards achieving universal health coverage and developing the health system to make it resilient and able to achieve the needs of providing quality healthcare in Nigeria and across the region. The program has trained the trainer model, and then from there they cascade the learning to other health workers. So if we look at the numbers cascading, it goes into thousands because we're trying to build the capacity of a core team that will cascade it, and with that model you're going to ensure sustainability.
Additionally, over 1,000 healthcare workers received specialist clinical training in areas such as emergency obstetric care, rheumatology, and breast cancer management. A main focus of the event was the mass migration of healthcare workers, commonly referred to as the JAPA syndrome.
One of the triggers for migration, I read a paper years ago, was how health workers in some developed countries were dropping their work because they were exhausted after COVID-19, and they need to fill those gaps, and they brought in more people from Africa and other countries.
Mbadiwe added that the GHWP, in partnership with the Ministry of Health, is working on policies to improve healthcare worker welfare, ensuring that trained professionals remain in the country to deliver quality healthcare. Saraki stressed the public-private partnerships and continuous professional development are crucial to healthcare retention.
You can never really have a duplication in a country as large as Nigeria. Well, over 220 million people. And the federal government, I think, recently announced having trained 2,800 healthcare workers. If you look at the ratios needed of healthcare workers and advanced healthcare workers, I'm talking about professors and registrars and doctors, in these type of innovative skills, it's clear that all hands have to be on deck. We will never work without the knowledge of government. So I think even programs like this, in which we're collaborating with government institutions, can be seen as part of government's impact. No investment is too large when it comes to saving the lives of a pregnant Nigerian woman.